Hello.
Good morning, everyone.
And it's like 3 minutes from noon. But we'll go with good morning.
I know, that's good. Go with good morning because that's what it feels like still.
That means the day's not half over yet.
No, that's very true. I'm like, if I just keep saying it's morning, then maybe I'll get through everything on my list today.
That's the spirit.
Yeah,
Starting the list.
that might be the only way to do it.
I'm gonna see if I can share my screen just to make it will work.
Perfect.
Right. Hopefully everyone will join. A bunch of, last minute people, as they always are.
How many folks ended up registering?
About 10, I think, or 12.
Oh, that's a nice group.
Small group. That works.
Perfect.
Hopefully meaningful conversation.
Always. What happened to the Lobo? It's not on screen. You didn't want him screaming at people. Louis the Lobo. Oh, there he is. I felt it. I feel like he should be more prominent.
They're still there. Still have all my toys in my office for those necessary moments.
I'm glad.
Yeah, these are things I learned from. I'm like, when I go into people's offices and visit, I'm like, what makes me want to stay in someone's office?
Mm-hmm. Very exciting office. Behind me, textbook binders.
The wall of binders says you're a very serious person, Liz.
And it's not the right impression to give.
Lindsay, where is your office
I
on campus?
in the family medicine building. So the psychiatry department is like on the 4th floor of that building. So
Okay.
you know that you've been to their campus.
Yes.
So
I don't know it well, but
yeah, like, did you go to the bistro? Does that sound? It's like the new Dominici classrooms. Now, if you
okay.
there's a big hole being grown in the middle of our parking lot. That's where the new College of Nursing in population.
Okay. I think I know what you're talking about. Okay.
Like there's a clinic, and then there's family medicine, and then there's us up on top.
Okay.
Hello.
Are you doing good?
Doing well. How are you?
Surviving.
It's that day. I was in your same building, Lindsay, for years.
Were you?
I was in family and community medicine before I came to the cancer center.
I hardly ever went to that floor, and then I finally went to it. It's just so interesting that we're like right above it, but the layout is so vastly different.
Totally different. Yeah, it really is, because we used to have meetings up in your space from time to time, and I'd get lost all the time.
Oh, really? Ours is just like one big loop. I went to yours and I got lost. I was like, there's like little random hallways and divided things up versus the center of ours. And You can't get lost. It's just one big circle.
Until you find the right room.
Yeah.
Yeah, it's worse now because I'm behind locked doors, so no one can get to me because my office is in the tumor registry, so they have to get badged in.
Yeah. Yeah, that's, I mean, having badge access isn't a bad thing, but.
Except when you lock yourself out all the time.
Yeah, that security knows you well though, because that happens more often than not.
Yeah. I finally broke that streak.
I'm surprised I haven't allowed like the capacity for phones to become like badges and
Oh, yeah.
to be able to access things, and you use them for QR codes now.
Mhm.
I bet all those times you locked yourself out, you had your phone. Nobody
Yes.
goes anywhere without their phone.
Yeah, I had my phone, but I didn't have my keys or my badge.
Yeah.
And it's usually on a weekend when no one's around, that's the best time.
That's always the best time. That's a sign that you shouldn't be working on the weekends.
That's really true.
It's a 12:05 sweet spot. That's like the time most people, 12:05 to 12:10.
That's right. Exactly. Well, we're on New Mexico time here, even though you're calling in from different places. And Naomi's like, you're in Colorado, but it's basically still New Mexico.
It's a similar pace.
Very, and lots of good people. That sounds good, Shoshana. We'll give it just another minute or two, and then Shoshana will introduce you and we'll just get started.
Sounds good.
Great. Well, thank you all for joining us today. This panel is presented by GMaP Region 3, and just a little bit about GMaP. We offer a number of different services to researchers at all levels, including scholarships for both travel and some pilot funding. And we will also be hosting a training summit in spring 2023. If you're interested in learning more about other opportunities that GMaP offers, please visit the link that I'm going to pop in the chat, and our contact information is also on the website, and we're happy to answer any questions you may have or provide you with additional information on upcoming events. Just a few housekeeping items regarding this particular event. The webinar is being recorded and will be posted on our website within a week. Everyone will be muted during the presentation just to eliminate background noise, but during the discussion portion, please feel free to either type your questions in the chat or to raise your hand so that we may call on you to unmute. If you have any technical difficulties, please message me and I'll be happy to assist you. And with that, I'm pleased to introduce our two speakers today. First, we have Dr. Lindsay Smart, who is an Associate Vice Chancellor for Leadership and Faculty Equity and Inclusion at the UNM HSC Office for Diversity, Equity, and Inclusion, and also an Associate Professor and Licensed Clinical Psychologist in the UNM School of Medicine Department of Psychiatry and Behavioral Sciences. Dr. Smart received her BA degree in psychology at the University of Portland and both her master's and PhD in clinical psychology from the University of Denver. Dr. Smart is committed to ensuring there is a diverse healthcare workforce in New Mexico. Currently, she is involved in initiatives that contribute to the promotion of diversity, equity, and inclusion among faculty, students, and staff within the UNM Health Sciences Center. Our second speaker joining us today is Dr. Naomi Nishi. She is a scholar practitioner with almost 20 years experience in higher education. Her research focuses on issues of racial equity and social justice in adult and higher education, particularly in STEM and medicine. She currently serves as the Assistant Dean of Diversity, Equity, and Inclusion in the College of Veterinary Medicine and Biomedical Sciences at Colorado State University. And with that, I'm pleased to turn it over to our speakers. Thank you so much.
Good afternoon, everybody. We're excited to have you all with us today. Dr. Smart and I have prepared a presentation. Even though this was billed as a panel, we are hoping to have some good conversation. But to help us to sort of guide our conversation, we put together a presentation. So I'll go ahead and share my screen to get us started with that. Let's go to the beginning of it. So we wanted to get started by sharing a land acknowledgement. I like pulling up this map of what is now considered North America. What you see on this map is different swaths of color that represent where different indigenous tribes resided and called home. And I like to just show this because it reminds me of the different understandings of land that indigenous colleagues and groups have as an understanding of that land that is different from what us non-indigenous and settler colonial folks have in terms of perspective on land. So I'll also say, since I'm at Colorado State University, that I am currently on the land of the Arapaho, Cheyenne, and Ute. And Dr. Smart is going to share the University of New Mexico's land acknowledgement.
Perfect. Founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia. The original peoples of New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to Indigenous peoples. We gratefully recognize our history.
So just as I was seeing folks join us today, I was getting very excited, and it made me realize all of the expertise that we have in the room with us. So even though Dr. Smart and I make up the panel, we're hoping that we will have a conversation today. And because we are hoping that it will be a conversation, whether you want to participate in the chat or if you want to unmute and verbally participate, we welcome that. But we want to just go over some group commitments that we'll hope that our group today can make to each other as we have this conversation. I'm going to suggest a few group commitments, and then when I'm done, I'd love to open it up to see what other group commitments y'all would like us to make to each other to make sure that we all feel like we can engage and feel like we're respected in this conversation. So please think about that as I go through these group commitments, and then we'll open it up. So I will listen when people are talking. I will allow people time to process. I will use I statements. I will critique ideas and not people. I will accept a lack of closure. I will take care of myself and take breaks when I need. I will not ask someone to represent a group. And I'll add on to that, I will not try to represent an entire group either. And I will challenge myself related to participation. What this one means to me is that for those of us who don't tend to like to participate in group conversations, we hope that you'll challenge yourself maybe today to engage a bit more in the chat or verbally. And for those of you who have no trouble sharing plenty of your experiences, that challenge might look differently for you, where we'll ask you to maybe offer a couple more beats before you jump in if you've already shared in the conversation. So let me go ahead and open it up to see if there are other group commitments that you all would add to this list. And I will say that we'll keep moving, as I'm not hearing any right now, but if at any point you think of something that would be helpful to have as a group commitment, you're always willing to add on to them as we go. So don't think that this was your only chance. So I'm going to hand it over to Dr. Smart here just in a second to get us started, but we wanted to do a little sort of table setting and context for what we're going to focus on today. When we had a conversation earlier on to decide what would make the most sense given what GMaP is, the work that you all do as researchers, what would be the most helpful in terms of a conversation around diversity, equity, and inclusion and justice. And we pulled up this diagram that comes to us from Kulhain Para, who is a community-based participatory action researcher. And I thought it was helpful to kind of think about research in terms of research-driven versus participatory. And how are we, particularly as GMaP has in its mission, research related to health disparities, how are we making sure that as researchers, we are centering communities that we're working with, particularly disenfranchised communities, and moving away from this more traditional researcher-driven model where the researcher decides what are the questions I want to ask, what is the methods and the process that I want to use to answer these questions, and then what is the impact, instead of engaging in the communities that this research is really intended to serve. So we had decided, or we had talked about focusing our conversation today on microaggressions. And we did that because what we tend to find in doing this work within academia and within the research fields is that oftentimes the first thing we need to focus on is how are microaggressions working, both as researchers in the field, both within our research teams. Do we understand what microaggressions are happening? Ones we may be complicit with, ones we may be wielding that we're unfamiliar with how they work. So we thought this was a good starting point. And so we'll talk about microaggressions. We are going to talk about them broadly as we go. So focusing on a variety of different types of microaggressions. So as I said before, hope that you will all jump in and share, because I know we have a lot of expertise in the room related to these topics. So let me move us on. And I'll hand it over to Dr. Smart.
Perfect. So let's set some groundwork just for some goals for today. That way, it allows us to really think about how we can think of microaggressions in the context of research and the research environments. Microaggressions happen, of course, in all areas of administrative life, clinical life, and personal life. And sometimes it's hard to separate out those pieces from the conversation of microaggressions. So when we get to the discussion part, it definitely doesn't mean that you can't incorporate some of these other places that you might be experiencing and witnessing microaggressions. But a lot of our talk will also try to ground us in the research context that we're all involved in as well. So goals, try to thinking about demonstrating an awareness of what microaggressions are. The more we know about the different ways it can be defined and conceptualized, the more likelihood that we will minimize our own committing of a microaggression. And then try to think about some steps. Some of those will give some steps to try to prevent microaggressions and intervening, which is often the hardest part of intervening with microaggressions. And then the discussion likely will generate strategies that we all might have utilized in our various spheres to address microaggressions too. I think the next one will take us to thinking about origins of the term and defining. I think that the term microaggression is full of lots of complexity. And I think when we think about linguistics, even just the concept of micro and aggression together, and I'm noticing that I put a typo in there. The idea of microaggressions has a history within psychiatry, psychology, and the origination of the term actually was more specifically created for Black Americans. And then it started to be utilized more with women, more specifically, and then has now, of course, come to capture all of the different groups that historically have not been represented in academic settings, to be much broader than just Black populations, individuals who identify as Black, as well as individuals who identify as female. One of the earliest definitions that we have comes from Dr. Pierce. One must not look for the gross and obvious. The subtle, cumulative mini assault is the substance of today's racism. And I think that thinking of academic environments and the things that we are monitor amongst ourselves and amongst each other then results in a lot of the subtleties of things that are said that really hone in on this definition of microaggression. We had Daryl Wing Su and his colleagues who also defined microaggressions similarly, thinking of it as brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative racial slights and insults toward persons of color. The key words in this, I think we often think about the verbal when we think about microaggressions, but the nonverbal components that might land in the behavioral or even just the environments that we create, whether on our walls, access to buildings, those are elements of considering how microaggressions might present in our research spaces or in our interactions with community members as well. We'll circle back on the intentional versus unintentional piece. I think that that's one of the hardest discussion points about microaggressions and what to do around them. And then this communication piece, and we'll also circle back on what it is a microaggression might communicate. Daryl Wing focuses on the hostility of an environment, putting people down and how it creates negativity. And then we'll also talk about how microaggressions can be utilized as a way to communicate not including people in the environments that you're might be working in.
So I think, well, let me offer a little extra background as well. I know that several folks on the call today are familiar with the research on microaggressions, and certainly know them when they see them, when they experience them in their day-to-day. But I also would like to offer some of these things that Dr. Smart and I are sharing as educational tools. I'm certainly using these to educate folks. As Dr. Smart said, one of the most difficult things to work with, particularly folks with mostly dominant identities, is to get across that it doesn't matter if you intended it, because what we see is when folks with dominant identities get defensive, that's usually the first thing that comes out of their mouth is, oh, I didn't mean it like that. But one of the tools that I find is important to share when talking about microaggressions is that it's very important to understand that they operate within systems of oppression. So I use this chart that I've adapted over the years to just kind of outline some of the different systems of oppression, acknowledging that this is not an exhaustive list. But I think when we talk about microaggressions, we have to start with what are these systems that they're operating in that make them different from just an offensive comment, which is how folks in the main tend to understand microaggressions, particularly those with mostly dominant identities. So I will go through these systems with folks. I will talk about here on the left, we have social identities in terms of race, gender, sexual orientation, class, ability, age, and nationality. But these all operate within oppressive systems, and many of them were created as oppressive systems for those that are fully socially constructed. So the oppressive systems on the right are racism and white supremacism, sexism and patriarchy, genderism, transphobia, heterosexism, heteropatriarchy, homophobia, classism, ableism, ageism, and nativism. And then we see within the middle that there are folks with dominant identities who are privileged groups within these systems who are receiving benefits from these systems. And then to the right of the privileged groups are oppressed and marginalized groups who bear the consequences of microaggressions within these systems and all the other forms of oppression that happen within them. I wonder if we should just pause and see if there are reactions, comments, or questions so far from the rest of the group.
I just want to say this chart is really awesome. Thank you for creating it. I had a couple observations with nationality. Something that I've noticed is on the oppressed, marginalized groups, it says undocumented non-citizens. As a person of color and someone who is an immigrant, but also now a citizen, I do still face a lot of microaggressions in that too. So I think something to note, especially when you do research and you have those sociodemographic questionnaires and things like that, that's something to consider. Another one under even race with being Asian and being South Asian, oftentimes like even within that class, like Eastern Asian, South Asians, Pakistanis, Bangladeshi, South Asian Indians, sometimes also get very there's, at least in the research that I participated in recently, I noticed that it was an Asian focused research, but all the questions were related to being Korean, Japanese, more Eastern Asian. And I didn't really find a place to participate because I was South Asian and I couldn't respond to any of the questions except for one or two. So that's something to kind of think about as well. Thank you again.
Thank you so much. And I want to pronounce your name correctly. Can you say it for me?
Yes, it's Cyril.
Cyril. Thank you, Cyril. I really appreciate that this chart continues to evolve. So I'm writing down what you're describing so I can try to make it a little better and specific. I think that's a really important point that you make, that it's not only undocumented undocumented and non-citizens that are oppressed and marginalized, but also the perceptions related to who do we consider or think might be undocumented or non-citizens. And it also brings up another point that I apologize for not making in advance, but the problem with this chart and putting it in these nice, neat little boxes is it's completely setting aside intersectionality that I think, Cyril, your point is describing, that we cannot just look at any one of these by itself. They are always operating together, which I heard you describing in a couple of those things. So thank you so much for sharing that feedback. Does anybody else have anything that comes to mind as Cyril's describing that, or are things you see missing or that you would suggest changing in this chart?
I wonder too, the intersection of microaggression with bias too. And I think if you think about how microaggressions are enacted, that comes with somebody's implicit bias about which categories they might fit into, kind of similar to what Sarah was mentioning. If I'm a person of color and somebody's bias is that people of color must not be American, then I would be, in their perspective, microaggressed from perhaps both the racist system and also the nationality, nativism system. So that would make a very complicated diagram, but is this intersection between those terms that might help think about those categories in the intersectionality way.
For sure, for sure. All right, I'm gonna move us on. And I think we've already addressed this, but I use this chart to then say, we have to be considering systems of oppression and their intersectionality to understand how microaggressions work. And we need to understand that microaggressions only go one way. They only work to harm folks with marginalized and minoritized identities. So I try to very early on in my education and discussion about microaggressions, cut out or end the conversation about things like reverse racism, or folks who are going to then share an example of they have dominant identities, but there was a time somebody said something and it hurt their feelings based on that dominant identity. And then we'll say, well, that's too bad that your feelings were hurt, but that's not a microaggression because it's not working to further marginalized identities. And it, again, going back to what Dr. Smart noted already, it's important, as Chester Pierce acknowledged, that microaggressions are happening in mass. So even to kind of combat the micro in microaggression, we have to understand that it's always cumulative. There's never just one microaggression that you're looking at in and of itself, even though I'll say that in the DEIJ world, we tend to pretend like we can look at just one microaggression and think we can intervene on one microaggression. It's really ignoring the damage that is cumulative from microaggressions.
I think this one is back to me. So digging a little bit deeper into the term microaggression, the subtlety and the insults are an important aspect of this definition historically, but there is this new book that if you like to read, or I'm sure there's some podcasts related to it too, called Subtle Acts of Exclusion by Jana and Barron, I'm forgetting the first names, as an opportunity for us to take a different look at what microaggressions are actually doing. And I think what's helpful about this reconceptualization is it assists with thinking more specifically about the impact of microaggression, as well as our role in interrupting and addressing microaggressions. Perfect, we've got references as well. So what Jana and Barron seek to do with reconceptualizing microaggression is to focus on the exclusion and inclusion components of these statements. So they're still subtle. They're often very confusing as you're trying to understand what has been said and what others might be experiencing in the moment. They're hard to identify, which then makes it even harder to speak out and address, both for perhaps the person who's been the victim in the situation, as well as for those who might be allying with the individual in supporting addressing a microaggression or a subtle act of exclusion. And sometimes they're so obvious to the person who's experiencing them because they've had multiple, maybe even in one day, but may not be as obvious to others because they may not be from those identities. So further adding complication to how to address a microaggression or a subtle act of exclusion. These are acts that they're things that people say, and they are things that people do. So the reconceptualization still involves that. It's not implying intent. We're really focusing on the impact here, whether it was intended or not. And they are purposely or utilized to exclude people. To remove people from a situation by the comment or the behavior or the environment that you have created by either the verbal, nonverbal, or just environmental circumstances around, spaces that we have.
And one thing I'll add on to what Dr. Smart is describing is the insidiousness of these most subtle and isolating types of microaggressions. So previously I've done research on microaggressions within college STEM groups, and even things where, and they were racial microaggressions, things where the white students in the group wouldn't say bless you or salud when a student of color sneezed in their group. And that would be shortly after a white student had sneezed and they all said, oh, bless you. And just those things that if the person of color were to say, hey, I just sneezed and you didn't say bless you, if they were to bring it up, it would just cast them out even further, because then you would have those white students being like, what are you talking about? I didn't even hear you. Those sorts of things that I think just get at how insidious, again, the very subtle types of microaggressions that I think, and I might be pronouncing this wrong, but Jana and Baran are looking at in this book that I think is important to acknowledge and even talk about, because those are the ones that often get left out of the conversation about microaggressions. And I wanted to pull up this chart because again, I find this to be a pretty useful tool. So this was focused on racial microaggressions, and this was created by Gerald Wing-Sue and colleagues that we've introduced you to the definitions they use in previous slides. But Sue and friends divide racial microaggressions and other microaggressions into these three categories of micro insults, micro assault, and micro invalidation. And I think we oftentimes talk mostly about micro insults. The micro assaults are things that would include, and I think Dr. Smart has some examples on upcoming slides, but even things like using a racial slur would be considered a micro assault, which also begs the question of what is micro about an assault. But within this framework, that's where those would fall. The micro insults, which we've brought up a little bit already, I think the where are you really from, and even things posed as compliments to folks with marginalized identities that assume they wouldn't be good at something or assume inferiority when coming from somebody with a dominant identity. Those are more familiar. What we oftentimes don't talk about is this last category of micro-invalidation, which is the dismissing of the experiences of people with marginalized identities or their perspectives. And what I find striking and that I use as I'm teaching about microaggressions is to talk about how micro-invalidations oftentimes follow up micro-insults. So if somebody uses a micro-insult, so say I were to say to a person of color, wow, you're so articulate, right? With the assumption being like, I didn't expect that you would be. And so I'm surprised. And then they say, hey, that's racist. You shouldn't say that. And I would be like, oh gosh, I didn't mean it like that. No, I tell everybody that they're articulate. So now not only have I used a micro insult, I followed it up with a micro invalidation. So they're, again, getting back to the idea of how they become cumulative, this micro invalidation tends to happen and when people with dominant identities, in this case, white, are getting defensive or there's fragility that's enacted, we see micro invalidation after micro invalidation follow that up. And I don't know if we want to pause again to see if there's other comments, reactions, or questions on these categories.
In some ways, this is a perfect way of following the sort of that micro invalidation, because whether these are said explicitly or not, I think that these are all frameworks of thinking about what a micro insult and a micro invalidation, and I guess also a micro assault would be communicating, whether the person intends it or not. This is the impact of those things. And so this is going back to just a slightly different way of reconceptualizing what is a microaggression doing. And it is saying these things, that you are invisible to somebody that they might have microaggressed against, that you or people like you are inadequate, that you are not an individual, you don't belong, you are not normal. You are a curiosity. You are a threat. You are a burden. So I think that even just thinking of these statements here, rather than the term microaggression, sometimes can be an opportunity to, when we get to sort of what do you do with these, to help educate and help reframe and help prevent somebody to go from that defensiveness and addressing. Because I like to think that I tend to be a type of person who is very glass half full and likes to assume that people are doing the best they can, and that oftentimes in the last few years has been a hard place to go to. But that if I help people say, like, when you said that, it wasn't just that, whether you meant it or not, you were communicating to me that you don't want me here, right? Like that this space isn't meant for me, that you actually don't see me as more than the group of people who my sort of demographics might suggest I belong to. And can be an opportunity into a conversation that sometimes is impossible to have if people aren't kind of seeing these different layers to what a microaggression really is communicating, whether they intend to or not, that's the impact it's having.
So I like to also kind of getting back particularly to relating this to biomedical research, we know that, and the literature bears out, that microaggressions, and I realize this slide is focused on racial microaggressions, but microaggressions do have a health impact. You see, so this is from Smith and Hung, who have done research on racial battle fatigue. And they show that there are impacts that people of color experience that are psychological stress responses, including frustration, defensiveness, apathy, irritability, etc. Emotional and behavioral stress responses, stereotype threat, increased commitment to spirituality, overeating or loss of appetite, impatience, quickness to argue, procrastination, increased use of alcohol or drugs, etc. And then these physiological stress responses, things like headaches, grinding teeth, clenched jaws, chest pain, shortness of breath, pounding heart, high blood pressure, muscle aches. So I think, again, it's important to contrast microaggressions with just hurting someone's feelings or saying something that hurts someone's feelings, because we do see that these stress responses are very real, not only emotionally, but physically as well, not to dismiss the emotional duress that is also a component of them. So we're going to turn now and talk a little bit about intervening and steps and things that we could do. But I wanted to pause again to see if, after we've gone through these definitions and shown some of the research on microaggressions, if there are ways that you would tie this into your own work, your own research, how it makes sense to you in the work that you're doing. So I'll give just a second for you to process, and you're welcome to unmute, or you're welcome, I have the chat open too, so if you'd rather participate in that chat, we'll keep our eyes on that as well.
I'll add one in, maybe it'll resonate with someone. I've been thinking a lot of like sort of the nonverbal and like the things about the physical environment that are essentially like in a different frame of environmental microaggression, and like the spaces, which I might resonate with folks who do research, and is a really important reason to think about community-based research when you are invited into a community versus inviting people into our research spaces. But you know, I walk into my building all the time, obviously, because I'm back in person and I'm not virtual, and I cruise around my floor, and I'm always just struck by what is on my walls of my department, which is oftentimes the chairs, previous chairs, pictures, all white males, residents and medical students, class pictures, almost all white, European American perhaps. I'm just thinking race. I can't tell a lot about other demographics from the pictures. And then I would say perhaps based on the pictures, more male. And so I just like every time thinking about, we have a clinic here, we have patients who come in, that the space doesn't seem meant for me. And so like just without even the wall speaking to me, the choice of things that are there is sending some sort of message to me like, is this really my space? Like, do I really belong here? Like, how have I earned this space because I'm not represented on the walls? And I think about that from the research context, because you're inviting people in to complete research measures, interviews, and saying you want something from somebody, and yet the space perhaps is threatening for reasons you may not be aware of until you find people are responding or maybe not choosing to come into your space. So I guess that's one thing that has, as I keep thinking about the term and the intent and impact of it, how even just the spaces that I'm in communicate that. Not sure if that resonated with anybody.
That resonated with me. One of the projects that I was working on, I work as a research coordinator, but on our project we're working with specifically young Latino MSM, and it was really hard to find, like when we were creating flyers to recruit participants for the study, it was really hard to find like iStock images to put on flyers that were resonating to this population with in terms of the body type, the skin color tones. Of course, with Latino culture, people, we have all sorts of range of skin tone colors. And we were consulting with our community advisory board, who were, of course, sharing information about like wanting to have as much inclusivity as possible with our flyers. But it was actually very difficult to find. And I think finding resources like that for researchers in general to be able to even include or even to think about how do we make a more inclusive airspace of models that can represent the community that we want to serve, and having that. And also, today I was lucky to be part of a team that was so open-minded to even that detail of connecting with the community on a recruitment level and making it as safe of a research opportunity for them, and not, thinking about historical issues with like research and people. So that was a challenge that we had, and something that I hope that we can fix by just providing more opportunities for models to represent in across all the races, of course.
Thank you for sharing that.
Yeah, I think I hear what you're saying, and I think of, so I write a blog, Justice, Equity, Diversity, and Inclusion in the Biomedical Sciences, and I'm required to have a stock photo, and that is an exercise in microaggressions and stereotyping. If you look for stock photos, for instance, I wrote a blog on Asian American Pacific Islander Heritage Month and was looking for a stock photo, and it was the exotification that goes on. And then on the flip side, we know that our faculty and our students and colleagues who are people of color tend to get this minority on display thing where they are asked to be on the cover of everything else. And we know that they're tokenized oftentimes in that way, particularly in these predominantly white institutions and spaces. So I think what you're describing is a real challenge and needs a whole lot of a dose of justice in all of those processes and procedures.
Yeah.
So I don't want to stop if anybody else wants to share, and you're welcome to interrupt me as we move on, but we'll start talking about what does it look like in terms of responding, preventing, and intervening related to microaggression.
So this first one really is thinking from an individual level. And I think in a few slides, we also talk about the systems level. And I think they absolutely intersect as being a person that we're all part of different systems in different ways. I think one of the most important things to do in intervening is to just know that they're going to happen all the time. And that's not giving permission for people to microaggress, but to expect it to happen. It's a prevention matter. Knowing that something is going to happen allows us to keep our radar up and build up whatever energy we might need in a moment to respond. And I also think it's important to think about the why. when it comes to individual, because I would say I'm like somewhere in between an introvert and extrovert. And in group situations where I don't know people, I am much less likely to speak up in situations. But if I can center on some sort of why for me, it allows me to override some of that anxiety and fear response to perhaps intervene in some way. And the why for me oftentimes goes to the fact that, going back to the very beginning, that microaggressions, subtle acts of exclusions are meant to keep power structures in place. And if I don't do something, I am reinforcing that power system and continuing oppressive environments. And it's also important for me to work somewhere where I enjoy working. And microaggressions don't create an environment that many people would like to stay and work in. And so in many ways, my addressing a microaggression helps me to create a place where I would like to stay and work, and where I am feeling like I'm including others in that same desire. Fear is an incredibly powerful response. And many people have a fear of speaking up in groups. And a lot of times microaggressions are happening in group situations. And it can override our values. It can override our own sort of feelings of compassion in many situations. So I don't mean to dismiss that this is something that is easy to do for a microaggression, responding to it. But I think it's important to name that it's very real to have an experience of fear, and to acknowledge that as the first step in figuring out how to overcome it. Empathy is an important value and experience to tap into when thinking about intervening when a microaggression has occurred. And it's hard to have empathy if you don't actually spend time with people, especially those who are not similar to us. The more we have experiences outside of our groups, the easier it is for us to tap into a feeling of empathy for someone, because it is not an us versus them sort of situation. It becomes an us. We are similar, and it's very easy to slide into the feeling is that somebody who's different from us is not like us, so they therefore aren't feeling things the way that I might be feeling things. And then there's this opportunity to think about when you are trying to kind of garner the personal strength to respond, that we do all have some power in these situations. And that may not be in direct moments of hierarchical power. It may be thinking outside of the box and how to utilize something that we have that we could conceptualize as power. But we can help situations and make people feel that they are enough. We can create steps and environmental actions to reinforce that people are individuals and not groups. We can do things to help create space that they are belonging, that they are normal, that we are special, that we are safe. And if I can use those statements, just like thinking about the impact that a microaggression or act of exclusion can have, I can use those on myself to bolster up my capacity to think about what I might do. It's easy to think that we could give like steps of like how to intervene. And I think this is probably worth a lot of discussion. There are times when I have not spoken up in a group situation, but I have very much gone afterwards and checked in on the person whom I felt like was microaggressed, and was sort of valid, like made sure that I was seeing things or hearing things the way that they were. What I have not been very successful at is what to do with the individual who's microaggressed. And a lot of times I think it's because I've been in situations where I have absolutely not had as much power as the person who was doing the microaggression. And so I would love to just sort of lay that out as a potential conversation point. I think that this kind of power component is a big part of why many times microaggressions go unchecked in certain situations. So I guess I'll stop with that and open it up to see if just even that little bit of information contributed to anything people would like to share related to intervening individually rather than systemically.
Hi again. I had a suggestion to something that helped me kind of growing up was workshops like this, or like different like leadership camps and stuff like that, and things that we would do to kind of tackle situations that were really tough, were just little plays or workshops. And so an opportunity like this where everybody is so engaged in wanting to learn more, but don't maybe not feel as brave to do it, you know, if they were kind of face to face in a situation, but just kind of practicing a link, just like some verbiage, like having one person act out as the microaggressor and then the other person act out as someone who can intervene, and just practicing it. And sometimes just having that voice to just say it out loud gives you the strength to be able to do it in action in real life. And even though it's in a safe setting like this, and we can always, like, you know, give each other feedback, what can do better, things like that. And so that's something that I think could be a possible way to help just practice.
Mm-hmm. Yeah, role playing is great. Yeah. And that's an opportunity to get out, because there's things I'm like, I just got to say it this way. And I'm like, no, that is not the way. So it's also good to have a space for somebody to be like, okay, get those things out of your system. But role play, it's like that practice knowledge. I agree. And in a space where you feel like you can say it the way that you authentically would like to say it and get feedback, I think is a very important strategy. Thank you for sharing that. You know, the humor piece is like one that I also think, like, when I feel like that's a really big conversation and thinking about basically how to manage microaggressions. I would be curious to hear people's thoughts on when we get to the discussion, because sometimes that's like a way of like processing what has just happened. And I find that that's like a big strategy that I use to just like kind of walk through what just happened. But sometimes I think about how I could use that as a way to address microaggressions, and in my head it never goes well, but I'd be curious if anybody's ever been successful doing that. Mm-hmm. Yes, Diana. And that, I think, we think about that from this when we get to the systems slide, thinking about how to intervene at a systemic level.
I think that's why it's challenging to do what you were suggesting, Dr. Smart, is sometimes when you're in these group settings, when the person who's microaggressing is at a higher level than everyone else in the room, even if you're at a slightly higher level than the person being microaggressed, it's challenging for you to feel empowered to speak back to that person as that compromises. I also find that, you know, as a woman in that situation, we are frequently on the same end of getting microaggressed by the same person. So you end up having a whole situation. It's usually people who are kind of frequent flyers of microaggressions, microaggress many people. So I think that's why it can be really challenging to speak up and know how to speak up, you know, for others and yourself.
Great points.
Another thing that comes to mind for me, and Deanna, I'm gonna cite your mom, but Margaret Montoya has talked about particularly classroom strategies, but I think they can be used in other places, echoing and islanding, finding a group that is in agreement with how they will resist these systems of oppressions, particularly as they play out interpersonally. And even though it was focused on a classroom setting, I could see it work in research teams as well. Whereas if one person says, hey, I disagree with this, here's why, then somebody says, I agree with so-and-so, and here's why. And you just kind of build it so that you are showing that it's not just one person who's saying this or feels this way, but you're building sort of that solidarity verbally and supporting each other. And then islanding, actually sometimes physically forming a group of folks that are in physical proximity when they're coming to each other's aid, for lack of a better word, as well. So those can be good things too. Oh, and Deanna has a citation for us too. Thank you.
Oh yes, I love microaffirmations.
And they're there.
There we go. I was like up there, but I've got a new citation that we've got to add here. So taking another spin on the term micro, like what could we do instead of aggressing to affirm individuals? So inviting opinions of individuals that may be unique to us, and creating that space also for people to feel comfortable sharing their opinions, right? So there is the danger of kind of calling out individuals in a way that can also end up in some ways becoming a little invalidating, if not a lot invalidating. So there's a little bit of a nuance to this, but if you're thinking of research spaces and dialogues that happen, how do you ensure that there is space, whether that's in representation, for those opinions of other individuals to be affirmed and experienced as a group and heard? Active listening, it's an incredibly hard skill. It's not just listening. I think we are tasked with doing lots of things in our lives that take attention from us. Some of which is very much on the surface, and some of it is just your brain is always working on things in the background, whether you want it to or not. So taking times or even classes on how to listen actively. Another way is empathic listening, and there's some wonderful work on how to really listen and hear, can be an opportunity to non-verbally demonstrate affirmation towards others. Yes, that's a great article, and a video on Loretta Ross calling out and calling in, how to create those spaces. You know, things haven't changed much from like grade school to adulthood. I think I have a kid in middle school, and I'm trying to think about like, who do you eat lunch with, and who do you hang out with? And you know, kids actually get this right a little bit better because they're still getting to know each other. They tend to have a lot more diversity in their groups. And then as you get older, you start to find different spaces where then everybody tends to be a little bit more like you than not. And so being aware of your, when you're going out to get coffee on campus or having a lunch perhaps that is sponsored, thinking about how do you create some space for being with others who are different than yourself. And I'll do just one last point here, and then Margarita will come to your hand raise. Giving credit to others is not done enough. Acknowledging when work has been done within your teams, especially research teams. There's a lot of things that happen that a lot of times PIs get full credit for, which does not mean that they have not done the work, but the acknowledgement for those on your teams that are doing the work is an opportunity to give affirmation to those individuals, creating further inclusivity and sort of interrupting some of those power structures a little bit. Margarita.
Yes, thank you. Thanks very much for this. It's really interesting. My concern is more than usually when you talk about micro aggressions, we focus on the majority whites against the minorities. I think that we need to move further. because the microaggressions are in all ways. I can have microaggressions against the whites, for example, okay? And one of the points that I see sometimes is not just the aggression per se, what I do is perhaps what I do not do. An example that, as you can see, I am Latina, okay? I am not originally from the United States, by being here more like 30 years. But I always ask myself, is a cultural issue or what is an aggression? I always got upset when I sent an email and 2-3 weeks later, I received no answers. So always I thought, oh, that is like an aggression, like they don't respect me, they don't answer my email, perhaps because I am Latina or because of whatever. So I always consider that as a microaggression. But I began to learn that perhaps it's the culture, or perhaps we are too busy and we don't answer the emails to our students, for example. I have seen students that say, oh, faculty do not answer. And I say, when did you write? When did you email? Last night. Of course, we are busy. We don't answer in 1 hour. No, we need take time. But I think there is something that we have to review about how long it will take to answer an email, because now we are talking about a lot of communication, but most of our communications now are through email or through webinars like this one. So imagine you are asking something to us and we don't answer to you. So how do you feel? You see, oh, these people are attending my webinar, but they are not listening, they are not participating. Yes, so is that a microaggression? So I am always asking at these intentional acts of inclusion. I always, since I began to look at this, every time I receive an email, I answer the email. Or it doesn't matter that I said, I am so sorry, I do not have time today, but I want to answer to you in 1 week. Or remind me if I do not answer you in 1 week. That is, I think, something small that we could all do.
I'm going to open that one to the group.
If I could jump in on a couple of things that you're saying, Margarita, I think, first of all, something that you're saying that's coming up for me is this idea of how do we have grace for other people, particularly as people are learning, and what does that grace look like? So I heard that sort of in the scenarios that you were describing of when do we say, okay, I know that I need to let this person have some more grace. One thing I tend to encourage, particularly around microaggressions, is to make sure that having grace for someone doesn't mean that you silently take it. You still bring it up. You still say, hey, I didn't get an email from you within a week, and I just want to check in because I felt disrespected, or something like that in your scenario. I think it's important to still voice those things, even while it's great to strive to have grace for other people, especially since we know microaggressions do not necessarily involve intent. So most of the time, I would say microaggressions are not intended to harm. They still harm. So how do we still bring it up and have the conversation? The other thing I heard you say that I might have misunderstood is that I would push back on the idea that microaggressions can go any which way, because again, going back to that chart we looked at, microaggressions as they've been defined in the literature really do only go one way, to harm people with minoritized identities. And that's not just within race, but we can look at all of those other things that are in the chart and then add on to it as we started to do. So I would just kind of add that context to what I hear you describing. I don't know if other folks have thoughts.
I mean, I think one example too of like where it's thinking of it of power or majority group, how it can be conceptualized in a lot of different ways. But if we think about things just within popular culture, we had that movie that came out that I can't remember, but Lin-Manuel's movie, that one of the recent ones, and it looking at aspects of colorism, right? So it was thinking within a minority group within America, or a Hispanic Latino population, but looking at the elements of why were there no dark Hispanic Latino people in this movie. And so a microaggression would be considered within the category of a minority group in America, but not necessarily a dominant group in thinking about the colorism element within there. So what is the, whether the intent was there or not, the impact of somebody who was not from a dark-skinned Latino culture being represented in the same way. So I think that would probably be the one thing that I would push back against, is it always is in a direction of oppression.
Yeah, but anyway, when we have a so diverse community, sometimes the aggression could be between one minority group to another minority group. I am in a minority university. So here in my university, majority are the Blacks.
Individuals who are Black.
Yeah, so that is exactly what I said. So if I am in my Latino community and we all are speaking in Spanish and somebody shows up and he's speaking in English, perhaps the microaggression is going to be against this person that is foreign to our culture. Mm-hmm. So that is what I said, it's not just the aggression, it's also the cultural part. And that happened to me. As you can notice, I speak with a very heavy accent. And sometimes I had to defend myself because I know sometimes people do not understand me the first time. I need to slow down. But I had to deal with that because in other way I will do, like you said, running with fear that I do not want to talk because people do not understand me. Mm-hmm. So when we do it in the other direction, I work in diversity and cultural competency. So I always imagine that the other option, okay? So sometimes the majority wise could be the minorities in a specific event. And we do that a lot when we work in community-based participatory research projects. So my project is specifically focused to African Americans, Bi and Latina, okay? So it could be a microaggression there because I am the one, the PI of the project, but I am working with this group. So I understand your point that the aggression is going more to the minority groups, but what I say is the minority and majority changes sometimes. For example, Latinos are now the majority minority group. Mm-hmm. And in 2045 or something, the whites are going to be the minority group.
If I could jump in on this, because I think it's an interesting point. I think we have to be careful to equate minority with marginalized, because as you're saying, Margarita, sometimes it is different. But if we went back to that chart, which we don't have time to flip back to it, we would see that it's marginalized group. So for instance, as an example, in the College of Vet Med, we are largely women in our program, not in our leadership, which tells you something, but most of the students are women. However, I get a lot of folks saying like, oh, well, now sexism has changed. I'm like, no, patriarchy is still the same, even though we have mostly women. So we can have a conversation about how do we have or how do we recruit more men to the program if we want to, but it's a different conversation than trying to flip that system. And the only other thing I wanted to add in there was, I think, Dr. Smart, your example about In the Heights is a good one, especially because the way that Lin-Manuel Miranda responded when he got that criticism, I think is another good model of how you respond to that. He said, you know, this is a fair criticism. and I'm sorry that I wasn't more cognizant. You know, he said, I'll do better next time, basically. I'm putting words in his mouth, but I thought it was a good model of, you know, he could have, and I would almost expect most folks to be like, what do you want from me? I'm trying to, you know, do this thing that's representing a culture that's been underrepresented. What do you want from me? But instead he said, no, you're right. I missed that.
Mhm.
Yeah.
Thank you.
Yeah. Oh, and Deanna says, we also are still operating within existing systems of oppression, which marginalize and oppress specific groups historically and contemporarily, regardless of numbers. Absolutely. Thank you.
Mhm.
I'm paying attention to the time, so I'm gonna move our slides forward or backward. Work it out. Because we're almost finished with our slides and we can continue our conversation. But Dr. Smart, did you want to?
Yeah, so systems level. So what is it that we can consider our systems and engage in those in our systems and organizations to really take a broader approach to addressing microaggressions. So systems should expect these to happen, especially as we are looking at diversifying our workforces, our research, our environments. When you bring people together who have historically not been together, microaggressions are going to happen, and they're going to happen a lot. And because things happen a lot doesn't mean that's a bad thing. It's about getting a more accurate perception of it, and then being able to figure out, and at the same time, hopefully not in response to, but in preparation for addressing them. And if you expect them to happen, what is it that the system should do to be prepared for providing professional development for the workforce, acknowledgement from leadership that that microaggressions can and will happen, and that you're not giving permission for people to microaggress, but you're naming it and creating space for people to talk about it. Communicating norms and expectations, whether that's formal or informal, for this to come, and since our systems at this point are still very hierarchical, it needs to come from folks who are in leadership initially to say, this is how we are going to address and not accept microaggressions when they happen. Creating a culture of speaking up is probably one of the most valuable leadership skills I think I would put if I were to think about choosing a leader. How do you create a space where there can actually be a conversation from multiple perspectives about what is happening? The goal is not to punish people, but you do have to create space for recognizing consequences. And that is a way of thinking about your role in an organization and how to create, whether that's policies or specific processes about dialoguing. And it goes back to also, the more you know the people that you work with, the easier it actually is to address things when they happen, because you are coming at the conversation from a place of knowing each other, and that can make it easier for people to hear. Letting them go interferes over time with what we would consider workforce attrition. So it's no point in making efforts to create a diverse pathway if people get here and are quickly like, no thanks, this environment is not for me. So the whole element of creating our workforce, our research to create that long path, microaggressions and exclusionary statements need to be addressed in order for that to be a complete pathway. Status quo is very easy. Regression to the mean, status quo, that sort of happens. And so when things aren't challenged at a systems level, things will keep going the way that they have always gone. So there's an example we have in here, a male employee consistently interrupting women or gender non-binary people in meetings, and nobody intervenes. And it will just keep happening. It will happen over and over. And it's not just an impact on the person who is being microaggressed. It's an impact on the whole system. It quiets all of those others in the group who feel that they will be treated the same way. People will stop talking. So I think, when there is silence in meetings, that doesn't mean agreement. A lot of times it usually means that people are not comfortable saying what they want to say. And this likelihood of somebody leaving an organization, not participating in research, leaving a research team are higher if you don't create this environment where they feel they can create spaces to say what's on their mind and address the environmental impacts of microaggressions. There's a lot on that slide.
No, it's good. I think let me see. I think our next slide is the CB-PAR one. But before we jump to that, and maybe we're probably a little late to open that back up. But I did want to offer another tool that I've found useful in trying to educate a community of largely folks with dominant identities here at CSU. I find that almost scripting for folks what to say if they are, if somebody points out that they microaggressed or their colleague microaggressed, just because I know they don't have the time to process it right then and there. So what I say is, if somebody brings up a microaggression that you have wielded, say either I'm sorry, or if you don't want to say I'm sorry, if you don't understand why you're apologizing, say thank you for bringing this to my attention. I'm going to go do some homework and figure out exactly what I did, and I'm going to do better next time. And so I almost script it for folks because I'm like, you have some work to do and you have some homework to do. It's not the burden of the person who has called out your microaggression to educate you. So don't ask them to. Go figure it out. Here are resources. You say this to that person in that moment to prevent those micro invalidations, to prevent that defensiveness that we know causes more harm. So I like to use that almost as a starting way of, until you understand what's going on, just say this, mean it, and do your homework. So maybe we'll, I'm going back to, maybe we'll spend the last few minutes. I'll go to the references. That I think I caught all of the references that we had in our conversation today, but we have, I think, 5 minutes left. So if there's any last comments, questions, or your own recommendations, I'd love to open it up. Thanks, Christina. So saying thank you instead of saying sorry. I like that, especially in professional conversations. Yeah.
I just want to say thank you for everything. This was a really great presentation about microaggressions, and I think it's so important, especially when we're looking at intersectionality and the fact that this is in all communities that we're working in now. I think we run the risk of sometimes thinking we're working, with minoritized communities exclusively in health services research if we're doing health disparities work, but the reality is all of those communities cross all of our research that we do. And so I think just having this, I can't wait until this is much more integrated into everyone's discussion. And it's not just the people who love to hear this and talk about it, but it's the people that, are sometimes reluctant to be at conversations like this. But thank you both for such a great presentation.
Thank you.
Thank you.
Well, if there are no questions, thank you everyone for participating. Shoshana put some more information in the text box if you want to know more about GMaP and our events that are coming up. And also, we hope to have more follow-up work with Dr. Smart and Dr. Nishi at some point coming up as well. So thank you all for joining us. And we look forward to seeing you at our next event.
Thanks so much.
Thank you, guys.
Thank you all.
Thank you.
Thank you very much.